Good day, Mom. I am going to tackle about STD or sexually transmitted disease. So first, what is STDs? They are caused by sexually transmitted infections or STIs. They are spread mainly by sexual contact. STI are caused by bacteria, viruses, or parasites. A sexually transmitted infection may pass from person to person in blood, semen, or vaginal and other bodily fluid. Sometimes, sexually transmitted infections are spread in a way other than sexual contact. For example, STIs can spread to infants during pregnancy or childbirth. STIs can also spread through blood transfusions or shared needles. STIs don't always cause symptoms. A person can get sexually transmitted infections from another person who seems healthy and may not even know they have an infection. Where do we get a sexually transmitted disease? You can get an STD by having vaginal, anal, or oral sex with someone who has an STD. Anyone who is sexually active can get an STD. You don't even have to go all the way or have anal or vaginal sex to get an STD. This is because some STDs like herpes and HPV are spread by skin-to-skin contact. How fast do STD symptoms start? Symptoms usually appear after 1 to 3 weeks but can start much later. Now, the best way to prevent STD or to protect yourself from STD is to abstinence. The most reliable way to avoid infection is to not have sex, and that is anal, vaginal, or oral. Second is vaccination. Vaccines are safe, effective, and recommended ways to prevent hepatitis B and HPV. HPV vaccination is recommended for preteens ages 11 or 12 or can get at age 9. And everyone through age 26 is not vaccinated already. Vaccination is not recommended for everyone older than age 26 years. However, some adults age 27 through 45 years who are not already vaccinated may decide to get an HPV vaccine. After speaking with their doctors about the risk for new HPV infections and possible benefits of vaccination. HPV vaccination in this age ranges provides less benefits as more people have already been exposed to HPV. You should also get vaccinated for hepatitis B if you were not vaccinated when you are younger. Third is to reduce number of sex partners. Reducing your number of sex partners can decrease your risk from STD. It is still important that you and your partner get tested and that you share your test result with one another. Is mutual monogamy. Mutual monogamy means that you agree to be sexually active with only one person who has agreed to be sexually active only with you. Being in a long-term mutually monogamous relationship with an uninfected partner is one of the most reliable ways to avoid STDs. But you must both be certain you are not affected with STDs. It is important to have an open and honest conversation with your partners. Fifth is use a condom every time you have anal, vaginal, or oral sex. If you have latex allergies, synthetic, non-latex condoms can be used. But it is important to note that these condoms have higher breakage rates than latex condoms. Natural membrane condoms are not recommended for STD preventions.